Hi, and welcome to Local Edition. I'm your host, Bob Jimenez. With me today is Dr. Jay Grossman. He is a rather extraordinary dentist. He helps the homeless in dealing with their problems with, well, I guess some significant problems, right? Because they're out there in the environment and they really need some help, don't they?
They do. They're missing teeth, and without teeth, they're going to have a very difficult time getting a job, and they're going to also have a difficult time eating.
Yeah, no kidding. Yeah. And it, you know, it raises their dignity. It gives them a second chance, because if you're walking around there with no teeth in your mouth, I mean, that's a big downer, isn't it?
It is. It's very, very difficult.
Okay, let's talk about the state of dentistry as it is, because there's a lot of people out there who still think going to the dentist is like sticking needles under your fingernails. That's not true anymore.
It's not. It's not. It shouldn't. Dentistry these days should be painless.
Yeah. And one of the new innovations is doing work on people's mouths without any kind of Novocaine or anesthetic, right?
Actually,
that's here now, finally?
And actually without using the traditional drill that everybody hates, that horrible grinding sound.
So what does it do? I mean, how does it work?
Well, there's a new technology out. It's called Laser Dentistry, and it's a machine that actually uses laser technology to cut teeth and to cut gums that's painless. In fact, moments before I came here today, I worked on a patient without anesthesia using the laser drill. So I could fill a tooth in minutes. You get to leave without being numb. It's remarkable.
And they sit there in the chair, and I bet you they're astounded.
Astounded, absolutely astounded.
Yeah. How come this didn't come sooner? Like when I needed all the work on my teeth.
There you go. Well, when this work fails and you have to come back in, then we could do it again.
Yeah. Are a lot of people getting into dentistry because of these, it's still expensive to go to school and pay off that huge bill before you start turning a profit. Is it still a lucrative enterprise for you?
It's still a lucrative enterprise. I've been very fortunate. I have a very large, successful practice, which I'm very fortunate and blessed for, and it's one of the reasons that I brought Homeless Not Toothless into my practice.
Yeah, because you could afford it.
And because it was a way for me to give back to the community.
Yeah, giving back, you offer them a chance to sort of get a control of their life and their mouth. You ask certain things back, like they can get off if they're on drugs or in some sort of dependency, you ask for that. But where do your donations come from that actually pay for this?
We have several foundations in town that have been very generous, like the Amundsen Foundation, the Mark Taper, the Skirball, the Getty. They all saw that this was a grassroots, local activity taking place here in Brentwood, West Los Angeles, and they said, you know, we want to help. We want to help get people off the street, help raise their pride and dignity, and they've been very generous. And all the funds, by the way, go towards the lab bill.
All right, with the time we remain, let's talk about independent dentistry. There are people still out there doing their thing, like you, in your own office. But more and more dentists are really forced to join groups, or health groups like HMOs. Is that the future of dentistry?
I don't know if it's the future of dentistry, but very often it's the very first step out of school. Hanging your shingle out right out of school without having any patience and with having extreme debt would be very, very difficult. So you go into a group, you get your feet wet, you get your confidence level up, and then again, you venture out.
Well, the question is, do you get your money out of it? Because all the profits go to the owners of the HMO and not necessarily to the practitioners who belong to it.
Well, then they make a salary, so they're living on a salary.
Yeah, okay. So it's good to be a dentist?
I love it. I've been doing this for 20 years, and it's still an occupation of choice for me.
Yeah, but sticking your finger in somebody's mouth, I don't know, I've never been able to figure that out, how every day for, how long do you work, 8 hours?
And what would you say if I was a proctologist?
Well, that's a whole different thing altogether. But it doesn't bother you, right?
I love it, absolutely love it.
Yeah, but seeing those teeth in there, and I mean, because I imagine you see some rather stark cases.
And you know what, I love that, because all I could think about is what they're going to look like when they're done. I love the extreme cases. I love the extreme makeovers. I love taking people that are fearful and moving them to a place where they're going to love come seeing me and love waking up and looking at themselves in the mirror.
Well, you know, you do all this work for the homeless. Maybe you ought to start reaching out to those who can't afford dental insurance. Have you thought about that?
Well, I do give breaks to people that obviously can't afford dentistry.
Okay.
Certainly.
And they're out there, certainly, growing in number.
They are.
Okay, but you see them and everything's okay.
You know, we do what we can to get them healthy and happy and looking good. Well,
you sound like a man who's very pleased with the choices he's made in life, and you certainly are giving back in the sense of you're helping the homeless and you're giving breaks to people who can't afford it. Thanks. Dr. Jay Grossman, a homeless, not toothless, and an extraordinary guy anyway. You've been watching Local Edition. I'm Bob Jimenez.